Hi, my name is Sharon Brennan. I'm a journalist at HSJ, and today I'm hosting a roundtable about medication errors in the NHS and the way forward in trying to reduce those. We'll be discussing issues such as training, patient involvement, technology and efficiencies.
1.1 billion prescriptions are issued every year. And medicine is the most common intervention in any health service in any country. The numbers are always going to be large, but when you actually start to look at them sensibly, then we don't have a higher error rate than any other country. We know more about our error rates than most other countries because we collect more information about it. We actually know a lot more about the taxonomy and the sort of the causes and not so much outcomes known.
Let's be realistic about what our resources and our ability to solve things and get better at prioritising than we sometimes are and saying we can manage this amount of work and let's do that first and then come on to something else.
This is what I would describe as a funding light environment, the medication safety programme. So we have the capital investment in the technology, but the rest is about doing more broadly perhaps what the sepsis programme did. Really is about showing what really good looks like and then getting systems around the country to use it.
We need to kind of do something about, going in on some of these big issues. And I think that if we go in on some of these things, then they have the potential benefit to kind of address patient safety across the board with lots of different things. They won't just kind of have that impact on prescribing medication errors, they can kind of impact patient safety more generally.
That is workforce and knowledge of workforce, because in our with our current problems around volumes of nursing staff, doctors and the solutions that we're bringing in, I'm not always sure that we're not lowering the threshold for errors. Because sometimes people haven't got the knowledge as they're coming through. We don't teach enough of the medicines practice, and particularly with the medical round and that change that I've just described, I just don't think the juniors are getting that education. And I think as we bring nursing associates through,
we've seen the number of beds nationally reduce statistically. That's evidence. So the doctors we can only make decisions to admit patients who are the sickest patients, and then we're trying to care for patients out in the community. There are far more patients now on our hospital wards that require IV antibiotics and IV regimes than ever before, which are more time consuming, much more, they require a second nurse check, they're much more onerous. And so we're building all this time the risk into the system and the process.
We know that junior doctors prescribe 85% of medicines in hospital. And Foundation 1 year 1 and year 2 are the main prescribers of that. Their error rate is twice other staff. But paternalism, in terms of the way that they respond to other clinicians, be that consultants, be that nurses, be that pharmacists, in terms of all those dynamics, is one of the major things that needs addressing in order for to have a learning culture of reporting.
Industry solutions will work in the real world as well, so don't forget them as a peer stakeholder. And also don't forget, and this is my regulator microchip that's been fitted some years ago, don't forget waste. Reducing waste can pay for increased safety.